Hi, I'm Dr. Sheva Marcus. I'm the clinical director and founder of Maze Women's Sexual Health, and I'm going to be speaking to you a bit about vaginismus, which is one of the most misunderstood and I think one of the most important things that we need to understand about women's sexual pain. Vaginismus is a condition where a woman can't get a penis into the vagina. It can be pretty insignificant. It could be she can get in a tampon, she can get in a finger, she can get in a small penis, and there's a lot of pain. Or it can be severe. It can be so severe that it feels like she's smashing into a brick wall when she tries to have intercourse. She's never been able to have a gynecological exam. She's never been able to get in a tampon. She can even be panicked at the idea of possibly having anything in her vagina. So vaginismus is very wide-ranging. And here's a really surprising statistic. 1 in 10 women have vaginismus. So that the statistic is somewhere between 7 and 15%. So that's about 1 in 10 women. That is a lot of women who have vaginismus, especially given the fact that it is a condition that nobody talks about and that people think is really, really rare. And what happens is that women who have vaginismus start to feel like they're crazy. It feels like a terrible black secret, a black cloud hanging over their head. They think they're the only ones. They can't talk about it. They feel less than. They feel like something is really wrong with them. And so then all kinds of secondary things start to happen. Some women who have it stop dating. Some women who get married and realize that they have vaginismus stop being sexual at all with their partners. And you do understand you can be sexual without intercourse. So some of these women had perfectly great sex lives before they got married or before they tried to have intercourse. And then when they try to have intercourse, all of a sudden they feel like something is terribly the matter and they just stop being sexual altogether. Here's the other thing you need to understand about vaginismus. It is unbelievably easy to treat. One of the things that makes me nuts is women who put off treatment because they feel so bad about themselves, or because they're so ashamed, or because they don't realize there's help, and they go through years and years without being treated. We had a patient who was married 11 years and had not been able to have intercourse. When her husband had an affair, she finally came in. 8 weeks later, she was all better. We had one woman who had been married literally 26 years, had 2 children through artificial insemination, and for her 55th birthday decided it was time to get this issue addressed. 12 weeks later, she was having pain-free intercourse. This is an easy thing to address and to fix, and so you need to understand that because it is so, so important. So let's talk about how we address vaginismus. The most critical thing to know about treating vaginismus is that vaginismus really is both a psychological and physiological problem. So it lives on a spectrum. You can have, let's call it an x-axis and a y-axis. So the x-axis is tight muscles. How many of these muscles that you're having are so tight that they're slamming shut and it feels like you can't get something in there? Some women have extremely tight muscles. Some women have muscles that aren't so tight. But the y-axis is fear, and the fear came from experiencing pain, whether you were aware of it or not. And so some women have a little bit of fear. They're not really scared of having something inside, but their muscles are tight and it hurts. And some women have huge amounts of fear. They're so panicky about it, they can't even consider going for a gynecological exam or having somebody get close to their vulva or their vagina. So if you think about it as the y-axis as being fear and the x-axis as being pain or tight muscles, you can live anywhere on there. You can have muscles that aren't so tight, but a tremendous amount of fear, or you can have a tremendous amount of fear and very tight muscles. You can kind of live anywhere on the spectrum. And the way that this problem gets addressed most effectively is when it is approached from both of those angles. An understanding of how much of this is fear and how much of this is tight muscles. Okay, so if you get that kind of understanding, it sort of puts everything back in its place, right? You need to get the muscles softer and more pliant and just easier to manage. Tight muscles are not complicated, right? We all have tight muscles. I mean, some women carry their stress in their backs. Some women carry the stress in their heads and get headaches. Some people get back spasms because they get stressed out, and some women hold their tension in their vulvovaginal muscles, and that makes the muscles tighten up, right? How do you loosen tight muscles? You loosen them the same way. Let's say you wanted to learn how to do a split. Every day you would work a little bit more to get those muscles to be softer and more pliant. So that's the muscle component. The fear component You need to address that a little bit differently. You have to learn to communicate. Your brain and your vulva have to start learning to communicate with each other. And you have to be sure that they know and trust each other so that you can continue the work together. And that is the two on the two pillars that treatment of vaginismus works most effectively. So, how do you treat vaginismus? Classically, you use dilators. And if you go online, that's what you're going to see. Vaginal dilators are little white sticks. They kind of look like pens, like little plastic pens. They start at a very tiny size, not much bigger than my pinky. Women have to put that first dilator in. They learn to keep it in for 10 minutes every night, learn to relax around that dilator, move up to the next dilator size. There are lots of different kinds of places that sell dilators. We work with dilators, and we have 9 different dilator sizes. Slowly but surely, you kind of work your way through the dilators. That's the getting your muscles to relax piece. The psychological piece can be different, and it's very different for different women. If there's a woman who's not that scared, then getting that first dilator in, it's a little bit of a practice and patience. We work with them. We do breathing exercises. We do guided imagery exercises. Sometimes we'll even use anti-anxiety medication. Once that first dilator gets in and women feel like they can actually get that first dilator in, usually they're kind of good to go. It takes a while. They slowly move up to larger sizes. Sometimes they have to deal with the fact that, their body is changing. It feels weird that their body is changing. But usually women do pretty well. An analogy that I often give doctors when I'm giving grand rounds on vaginismus, and I speak about this quite a bit, because people do not understand how vaginismus patients feel, is I say, you know that you have a hole in the pupil of your eye, right? So you just sit there, and I'm going to take this pen, and I'm just going to slide it into the hole, which is the pupil of your eye. Most people at that point will say, holy, no way in hell are you doing that? Like, get away from me, Batsheva. I am not sitting here for that. And that's how vaginismus patients feel. And so working with vaginismus patients, really, we need to kind of slowly educate them, give them a sense of control, let them understand that it's not going to be painful, and slowly but surely, they too can start adding those dilators, putting those dilators in, taking them out, putting them in, taking them out, and over the course of 8-12 weeks can work through the dilators. There are some women who it is just so frightening. The idea of having something put in vaginally is so frightening to them, they just cannot comprehend that. They do not want to do it. As a matter of fact, I always remember back to maybe 15 years ago when I was working with one patient, and she literally hyperventilated on our exam table. And at some point she sat up and she said, Batsheva, I can't do this. There has to be another way to do this. There has to be. So it took us a while to find it, and now we have a Botox procedure where we bring women in. It's a 15-minute procedure, but women are put basically under conscious sedation, so there's no stress for them. At that point, we press open the muscles, insert the dilators, and then when they wake up, usually very calm from the sedation, they have that first dilator in. For many women, it's life-changing. And their reaction is, oh my God, I really can put something in there. There really is a hole in there, Batsheva. I can put something in there. For those women, I try to say to them, this is not the answer that's going to end everything, but it's the beginning of the process. You still have to get your brain and your vulva and vagina speaking to each other. But the Botox procedure can kind of jump you over those first few steps of introducing the first dilator. So I want to end this lesson with the most important message. That is, vaginismus is not uncommon. You are not alone. You are not crazy. It's really common. And perhaps more importantly, it's really, really treatable. So don't wait, even if this seems so overwhelming and so scary to you. And even if you think, like most of our patients do, like you are the worst case we have ever seen and there is no way we're going to be able to help you, even if you feel like that, reach out for help. Because I promise you, you are helpable. This is fixable. This can be better. And you deserve to live a full and satisfying sex life. You deserve to get all the pleasure life has to offer you. So reach out and get help if you have vaginismus.